Are you already registered at Wikisana?
Hello and welcome to the format of Natural Medicine. Nice to have you back with us. Today we will talk about chelat therapy and toxopheresis, two terms that may be completely new to some of you. One or the other may have already heard of it, but maybe no one really knows what one is and what the other is. When do you use one and when do you use the other? Today we want to clarify this with our expert, Dr. Harald Burgard, specialist in internal medicine. Stay tuned, we'll start the conversation in a moment. Hello, dear Harald.
Hello, Alexandra.
Nice to have you here with us.
With pleasure.
Again and again an exciting partner in our interviews, who often creates hope for cases where you say that this is a story where you have no control in classical medicine. Where you say that you can only suppress it, so that it doesn't grow any further. But in your practical experience with your therapy forms, you simply have other experiences. So also for the diseases for which there may not be a good outlook or for which there is no control in classical medicine, you also know solutions. And that's what we want to talk about today. We have two terms in the room: chelat therapy or toxopheresis. And I would like to ask you to explain to us what one is and what the other is.
Yes, with pleasure. As a child, I had severe allergies for a few years that never went away, with asthma and so on. And I found out what it means to be chronically ill until I got to know a therapy 20 years ago that helped me to solve the problem. And that excited me as a doctor so much, because I never knew it that way, that I just looked at how I can help people. And so I came more and more into the field of cause therapy, of finding the causes first, of looking for the causes. And then suddenly toxins appear on the map and you deal with environmental medicine. Today we call it clinical environmental medicine. And if you then hear and read, what can you do there? How do you get these things away? How can I extract heavy metals? Then I heard concepts with chlorella and whatever, which were all nice, but which in the clinical application never really worked for our patients. And above all, I could never prove that metals in urine, in the stool or wherever come out. I let people collect stool and urine for up to 3 days for 2 years and could not prove that something was coming. And above all, I could never prove that it really works better for them. Until I came across chelat therapy at some point. That was around 2002. And that is a procedure that we will talk about in a moment, simply to remove toxic metals. Now, of course, the question is, what is toxic at all? Why are the substances we deal with from the environment toxic at all? And I keep hearing the argument from many on the side, that people are in the old age anyway many times with toxic metals, with lead and so on, but sometimes there are many and then there are only small amounts. In both cases, that is completely wrong and too short-sighted. First of all, I have to say, just because many people have diabetes, I still have to treat them. Just because many old people have high blood pressure, I don't say they all have high blood pressure, we treat them. Because it is a disease that has consequences. So it is the same with toxic metal pollution. We have countless studies that show what lead, calcium, mercury, and so on does. And if you then hear, yes, these are just small amounts, then I have to say, the one who says that, he has little knowledge of the effect of such substances. Here, for example, you can see the effect nicely. If I have toxins in my body, then they can have a toxic effect. Yes, but they not only have a toxic effect, they also have an effect on the immune system. That means they lead to inflammatory reactions, to defense reactions, to autoimmune reactions. They trigger your inflammatory substances high, even without having to trigger a toxic effect. Then they act, as they say, hormonally disruptive. In German, many substances act, for example, similar to estrogens and trigger your estrogen receptors. This can then lead to breast growth in men, that women who, for example, have breast cancer, which reacts to progesterone or estrogen, are permanently triggered by it, so that existing tumor cells continue to grow. All two-dimensional toxic metals, such as lead, aluminum, and so on, all act hormone estrogen positive. Then, of course, these substances can also allergize. Nickel, for example, is known to cause allergies. Nickel is also a substance that is poisonous in a certain amount. Nickel can cause inflammation, but also allergies. Many other substances do the same. Of course, we also know from many of these toxic substances that they can change genetics and, in the worst case, can also trigger cancer. That means we have a variety of effects on these substances and no one can say what exactly happens in your body. In addition, if we have a substance and have a limit value, let's say lead, then I can say, lead can cause muscle pain, lead can cause lead colic, lead can make you depressed, and so on. But if someone is even stupider and has mercury from tooth filling, aluminum from deodorant or 4 other things, then I suddenly have 5, 6, 7, 8, 9, 10 metals and maybe 5, 6 other toxic substances and no one knows how they potentiate among each other. Then there is the so-called Haber's rule. This is a rule recognized in the toxicology teaching for substances that enrich themselves in the body, for cumulative toxins. If I take in a large amount of a toxin, I immediately have an effect. But if I have the same toxin in a small amount for a long time in my body, then it also has the effect, only years or decades later. If I have such a substance in my body and do not excrete, then I can get sick. Or Avogadro. The Avogadro number tells me with a molecule how many molecules or atoms, if it's about atoms, are there in a molecule. If I look at such a burden that we pull out of patients and see he has so and so much microgram of lead, then I can calculate how much is in the whole body and then I suddenly see he has calculated the total number of his cells, 10 or 12 lead molecules statistically in every cell, and then I also know that this can have an effect on the whole body. And then rediffusion processes. If we go and pull out toxins out of an area, let's say from the blood, which are chelat therapy or whatever, then I reduce the concentration of lead in the blood, for example. But in other areas, in the kidneys, in the brain or wherever, the concentration is still high. But now the body always strives for a concentration balance. So the stuff runs after, that's called rediffusion, and then it goes up again in the blood. And so I can see through these rediffusion processes that complaints come back when they go away, but then disappear when I've treated often enough, and this rediffusion has led to the burden in all compartments going down. These are things that you have to consider before you even talk about how do I treat someone. And then our goal is always with the treatment not to bring the patient to zero with a burden, that will never succeed, but to get so far down that his individual tolerance threshold is reduced. And that is different for everyone. There are people, you know that, they smoke, they drink, they do everything wrong, but they don't get sick, they have a damn high tolerance. And others, they once smoked a cigarette and got lung cancer. They have a very low tolerance and you always have to make sure that you get below your individual threshold and then the immune system levels out, then the immune diseases go away and so on. But that requires a treatment time or a multiple treatment and then I can't say, well, I've done 5 chelat therapies and it's not good yet, the therapy doesn't work. It's like when I do an operation, I cut open the chest and stop in the middle and go home. Then everyone will also say, the operation was shit, it didn't work, but not because the operating technique was bad, but because you stopped too early. So you finish the operation, close it quickly, then the operator can go home. And that's similar here. You have to treat the right thing and you have to treat it sufficiently often so that an effect can occur. And of course I can check that chemically in the lab by testing blood, urine, and so on and see what happens. And then of course the question is, what do the things in the body do when I talk about lead, cadmium, and so on? What happens there? We have a so-called redox equilibrium, that is, we form free radicals in certain processes. These are aggressive oxygen or nitrogen molecules that can help us kill pathogens, but they can also harm us if they are too much. That means we need an equilibrium so that we don't get sick. But free radicals like iron, copper, if they are too much, then they solve the problems. If your iron storage, your ferritin, for example, is at 500, then the iron in the body already makes inflammations and can trigger vessel calcification, Alzheimer's and all sorts of things. So look what's going on. Or toxic metals can block enzymes and then the digestion is bad. Then the breathing is bad. We need enzymes, for example, to form energy. Then the brain functions, the synapse functions are bad and so on. These are disturbances of enzymes. Or, as I just mentioned, the toxic metals can trigger estrogen receptors. Then you suddenly have too much estrogen compared to too little progesterone, for example. This is called estrogen dominance with all consequences. Women get endometriosis complaints or premenstrual complaints or tumors grow or whatever. The mood goes down and so on. Then we have processes in the body that are called apoptosis. When a cell gets sick, it initiates a mechanism to die. That's exactly what tumor cells don't do. But the healthy cells die at some point. But if we load them with toxic metals, then either too many cells die or those that should die, they don't. They can also make us chronically ill. Or in the worst case, cancer can develop over a long period of time. Then protein synthesis. Proteins are proteins. When building a house, the stones in the body are the structure-building elements. Proteins are very complex folded structures. They usually have a centralium in the middle. If there is calcium in there, for example, and instead of calcium, lead comes in, then that changes the size, the shape, it doesn't hold together anymore. We all know that when we buy medicine, we open the box, take out package insert, we never get it folded back again. If you put that thing in the box, it has a hump and doesn't close properly anymore. The same goes for proteins. If they are built in incorrectly or don't fit, the cell membranes are suddenly disturbed or other structures. That makes you sick in the long run. Then we see that from small amounts below the actual poison limit, the subtoxic amounts, if they are in there long enough, of course, nerve disorders can occur, myelin discs can be disturbed, then MS can develop and so on. These are things that can occur on a multifaceted level in the body. That's why it's so important to reduce the amount as far as possible. The patient feels better. In the past, when it came to metals, we managed to do that very well with the so-called chelat therapy. Chelat means cancer. These are structures that have arms like a cancer sphere that are able to bind a metal. That's the cool thing about it, until the stuff is out of the body. There are substances that also bind some metals, but we let them fall again for a few seconds. Then I have a transport from the kidney to the brain or from the heart to the liver. But that's still in there. The goal is to get it out. With chelat structures, DMSA, EDTA, zinc DTPA, DMPS, as they are all called, I can bind toxic metals and bring them to the urine for excretion. Because the people who can excrete the stuff store it like that. We basically only have one detoxifying enzyme in the body, glutathione S-transferase M1, which is able to excrete toxic metals. But exactly that enzyme is missing from half of the people worldwide. They store the stuff. And what you can't excrete with even the best nutrition. That just doesn't work. If your car doesn't have an engine, you can polish it, you can check the air pressure, you can run the fuel tank full. The thing won't run because the engine is missing. That's how it is here. When you do a chelat therapy, these toxic metals are bound. They are excreted via the kidneys as a bypass. Free radicals are reduced, which make the inflammation, which can attack the vessels, etc. The enzyme functions get better, the protein folding, the blood circulation, the defense. All of this is known for a long time. But we suffer nowadays in our environment not only from toxic metal pollution, but also from paints, varnishes, environmental poisons, from furniture. We used to have formaldehyde emissions from these chipboard, or from other things, and all that you keep in check with the chelat therapy. I noticed that after over 50,000 chelat therapies, which helped people a lot, we reach limits. At some point I got to know a process via apheresis, with which you can bind almost any environmental poison, excrete it and prove it. This is called toxopheresis. This is a blood sample for chronically ill to remove environmental poisons. You can pull it out and prove it.
The chelat therapy, if I may ask, how does it work? Toxopheresis is washing the blood.
Chelat therapy is an infusion therapy, where the substances are given to the body via infusion. They bind the metals and are sent to the kidneys. There are also substances that can be taken orally, but the oral intake is usually less effective. That's why it's usually done via infusion. The blood wash is a bit different. The patient lies in a comfortable bed. On the one hand, blood is taken out, on the other hand, it comes back, and in between it is directed through a filter. This is a process that is safe, that has almost no side effects. I can say that with good conscience. I'll explain why in a moment. With this, you wash out the blood, of course, but also the tissue, the lymphatic system, and through the rediffusion, also from the organs over time, the toxins out, without needing substances. Because some people react very sensitively, they also react allergic to one or the other substance. Of course, I can avoid that by simply filtering the stuff out without needing an infusion, without having to admit anything. With this, I can get a whole series of environmental toxins out. We all know DDT as an insecticide or glyphosate, or solvents, paints, tints, softener, silicones, which are also in the breast implants, when they break, etc. We also have patients with such things, combustion residues, benzene, spike proteins. There is always talk of spike proteins, car exhaust, microplastics. I find that with almost every patient, microplastics. You always think, well, that's somewhere in the sea. The sea is far away. But what they throw into the sea in Bangladesh, we have afterwards in the Saarland on the plate, or in Austria, or wherever. These are things that I can bind on top of the metals and remove from the body. What comes out of there often looks impressive. Up there, that's a bag, that's pure elute. That means there are the pollutants in it, that we pulled out of the people. Washed out. And down there, this stuff that looks like cola, is not cola, that's actually just water, where we put the toxins in, which we pull out. And that's impressive. If you then put such an analysis next to it, then you see, aha, he has aflatoxins, that's fungal toxins, very high, or benzopyrene, or benzoate, or cadmium very high, or hexavalent chrome, that's highly toxic chromium, and so on. Then you see from the 47, I counted, there were around 30, which are very high. And then you are amazed and think, my God, what does he have in his body? And that's just a small number of thousands of substances. We potentially come into contact with 350,000 substances. That means you can't determine everything, what ultimately pollutes the body, or what you can pull out. And if we then do such a toxopheresis, then we don't just pull out these toxins, but we can also lower autoimmune antibodies and pull them out. And we can reduce them through the process and can also prove that and then also see that people are better off, that they get fit again relatively quickly. And you can do that with circulating immune complexes. These are other inflammatory reducing substances. If the body doesn't remove them, then they cause a problem. We know immune complexes. When a foreign body comes in, it's called antigen, then an antibody comes, binds it and marks it, so that the eating cells know, I have to eat this complex. But if that happens all the time, then at some point they are full. Then they leave the food lying. And these circulating immune complexes make people sick. They can cause problems in every part of the body. Autoimmune disease, inflammation, pain, whatever. And we pull out inflammatory substances. You can see that very well in the lab. You can even prove that within minutes, how the blood secretion decreases under the toxopheresis. We can reduce viruses, Borrelia toxins. We can also improve the blood-brain barrier. We can seal them. You can see that very well on the S100 protein, how quickly the value in the normal range decreases under such a treatment, how well the energy improves, how the fluidity of the blood improves. We have also seen in the ophthalmologist colleague, who was in another program, how the macular degeneration can be treated. That was just one example of many such patients, where you can see that if you remove toxic metals, if you remove environmental toxins of all kinds and the inflammatory antibodies, then the body is so relieved that it can regenerate again. What does the therapy do? You do it yourself. But this ability has to be released again. You can support that very well with such procedures. What is always important to me as a doctor, the therapy is tolerable. The only thing we see in side effects is that people get a little swelling afterwards, on the fingers, on the feet or under the eyelids, are a little hoarse for a few hours and are also a little tired. That's the only thing I've seen in thousands of such treatments. What I'm getting out of today is therapy, but it's also a prevention for the future. The toxins that are no longer there today, they don't work for years in the sense of the Harvard rule and make you sick. With that I always have a prevention in connection with a therapy. There are very few things you shouldn't do if you have an acute fever, an acute infection, or just have a stomach ulcer, or if someone is really exhausted from a tumor. These are things where you say stop. You don't do that, but with everyone else. You can also use such a therapy very nicely with young people because it has almost no side effects. What I was just talking about, the slight swellings, these are temporary things that don't really burden and are over after a few hours.
If we now have a tumor patient who is so exhausted or has no energy, where you might say that would be counterproductive, is there a possibility to put this patient in a state where he can do it?
If he hasn't exceeded the point of no return where he is about to die, then of course you can always use procedures to rebuild the person, to give him strength, to give him energy. If he is in a state where you can say, now the treatment is possible, you can of course do that. But you always have to weigh the benefit against the risk and not treat someone where you know that this is going wrong.
No question. I just wanted to know if there is no option at all or if there is already a strategy where he can also be treated.
You always have to think about it. There are possibilities in most cases.
From my point of view, because nowadays we can't say where we collect any toxins. They are usually not visible in most cases and just surround us all the time. From my point of view, everyone should at an early age, at regular intervals, do a toxopheresis, right?
At a kid's age, maybe a bit too early, but I agree with you. Either we stop breathing and put on a full-body condom to be protected. That is practicable. But you have to look again and again. The sooner you start to look, what do I have? The sooner you start to eat properly and live properly and reduce the things that are stored, the better it is, of course. That is prevention.
To help the body, no matter what I do, so that it can maintain its regulation.
Absolutely.
Toxopheresis. I haven't heard that much about it yet. I've never enjoyed it either, but I'm interested in doing it. What did you collect in your life? How is the body able to deal with such things? Do I belong to the 50% of the bodies that can extract these metals themselves? Or not? But these are all risk factors. How widespread is this toxopheresis that I can use it?
Toxopheresis is a therapeutic apheresis. The first therapeutic apheresis has been around for 40 years. However, there are other approaches. You use them to take out fats. For people who tend to have heart attacks because they have high lipoprotein or high triglycerides and are not treated with medication, they take out fat, but we take out environmental toxins with special filters. Because I can't do it all by myself, we decided to train colleagues to install centers in Germany and other countries that can do this. We are now in Germany 14, I think. We have some abroad now, so that a good supply is guaranteed. Of course, that is still not enough for the whole of Germany. But the colleagues exchange among themselves. They are also brought to the same level. Everyone has their specialization, so that when you exchange, you also have a gap compensation. For example, you do this lab, you do that lab, we pay attention to this, we pay attention to that. It is a very nice exchange. We have seen an ophthalmologist who also works with it, has very good experiences. That's how we see it in nephrology, in kidney health, that's how we see it in internal medicine among us.
An ophthalmologist who now not only treats the eye problem, but also many side effects or non-side effects, many other problems that the patient still had, he also treated and eliminated.
As an internist, the eyes have the same effect as if the same therapy was done by an ophthalmologist. The effect always affects the whole body. The ophthalmologist looks at other structures.
When it comes to chelat therapy or toxopheresis, if I understood that correctly, toxopheresis is also more tolerable and more comprehensive, then the decision is always more in favor of toxopheresis. Is that correct, or do you say that chelat therapy is definitely indicated there?
You always have to look at how much a patient is burdened, how sick is he. I always try to do as little as possible, but as much as necessary, if he has mild complaints and he doesn't have any too big conspicuousness. I know I can treat that with chelat therapy at a cost-effective rate. But if I have someone who is really chronically ill, who has autoimmune diseases and has been going on for a long time, and he says, I want to get out of it, then of course I take what is best in terms of medicine. And that's the toxopheresis, because at the moment it is the most of what is possible. Then I would use something like that, because in addition to the metals I also get all the other balloons with environmental toxins out. And that's just a lot more than just metals. And then there are all kinds of things. There are also other things like mold, fungi, and so on.
And actually in the present time, where we have so many burdened people from the microbe crisis that we have brought with us, there would be a huge potential that could benefit from it.
So people have to get to know it first. They have to know that it exists. And there are already people who deal with it. There are also other apheresis procedures where you can see that you can help people with it. They pull out less environmental toxins, they pull out fat and a few inflammatory substances. Here you go the way that in addition to the inflammatory substances you also get the environmental toxins out, which also burden a lot. And these are procedures that can prove to be effective and also bring the inflammatory values down. And that's just what helps at the moment. It didn't help people in any way when I tell them, you're dead tired, but move more, relax, do yoga and so on. That's all nice. That's certainly good for the psyche and for the general well-being. But that doesn't solve the problem. And I'm someone who always tries to find the causes, to point them out, and when they are gone, to point out that it's over. And that's what we use such procedures for.
Wonderful. Now our viewers could Google you and will find you. But as far as I understand, you have a full practice. But that's why you also have a cooperation.
We have a platform where you can find other colleagues. Exactly. If you type in www.med-select.de, then you can leave your data and then you will be contacted.
www.med-select.de eingeben, dann können Sie Ihre Daten hinterlassen und dann wird man Sie kontaktieren.
And then you can choose colleagues who are close to your place of residence or who are able to treat you.
And who are connected. If you need additional treatment in another direction, which is not your field, you can get recommendations. And I think therapists can also contact you there. If someone is watching us and says, that sounds exciting, I could also consider integrating a practice.
We also train therapists. We give them the opportunity to say, I have my patients and I want to keep them, but I would like to have the therapy come to me. Then you can recommend them to a center that only does the therapy. And then the patient goes back and the colleague does everything else. We have different options, so that you can help as many people as possible. That was the intention behind it.
Because you are also happy that the toxopheresis therapy is usually not the only building block on a therapy path or in a concept. I have to look at people in a holistic way.
I have to know the genetics, I have to know the whole thing.
Ich muss das Ganze drumherum kennen.
I am enlightened now. I know what it is. And I think our viewers do too. I thank you from the bottom of my heart and look forward to the next conversation. Thank you for your competent and detailed information. I'm looking forward to the next one. I thank you very much too, that you tuned in. I wish you till next time, that you stay mindful, attentive and loving to yourself. Until then, bye.